importance of vaccines. This topic is very important to me, but most importantly, it's important to the children that we serve. Vaccines are one of the most important tools that we have to protect children's health. And CHOP has long time been a leader in the development of vaccines and the education of vaccines through our trusted Vaccine Education Center. Governor Shapiro here shares our commitment to help families learn about vaccines and access vaccines. And as the son of a beloved pediatrician from our region, Dr. Steve Shapiro, I would expect nothing less than for him to be a big proponent of vaccines. I'm sure you've learned about the importance of this throughout your life. The governor has joined us today to discuss recent actions that the administration is taking to improve access to vaccines, and he's going to be joined today by a number of CHOP experts who will help emphasize the importance, and his team as well. So Governor Shapiro, thank you for coming and for doing this, and welcome back to CHOP.
Thank you. Good to be back. Thank you, madam. Thank you. Thank you. Madeline, thank you. Thank you for your leadership, not just here at CHOP, but the work you do civically all across our city and our Commonwealth. You really stand out, and you're an incredible leader, and I'm grateful to partner with you. Again, not just here at CHOP, but on so many different things. You all are blessed to have Madeline leading the effort, and I know she understands CHOP is only as strong as the amazing doctors and nurses and staff, many of whom are here today. And I just came today to say thank you for the incredible work you do. For me, this is kind of as close as I'm ever going to become my dad or be like my dad. I will tell you that I went to college to be a pediatrician like my dad, because I held him up as just my hero, because he's someone who goes out every single day helping children feel better, helping families get through the stress of a really challenging moment. But apparently you guys have to take organic chemistry, and that didn't work for me, so I never quite made it, but I get to help children this way, and that's a big reason why I wanted to be here today to talk about the future of children's health and Pennsylvanians' health here at the premier children's hospital in America. I've said to Madeline many times, I feel so blessed that CHOP is here in our Commonwealth, and I hope to never, ever need it. And I think that's how most people feel, and I say that with the utmost respect. We don't want to have to walk in these walls, but if you do, if you walk in these doors, you're just so thankful that you all are here. The expertise, the caring, the love that you're able to provide to families is really, really remarkable. So I feel really blessed to be here today and really honored to be in your presence. And I'm grateful to be here, as you heard before, with Representative Khan, who's been a great partner to me in the legislature, and we're thankful for your votes on many things that support CHOP, and thank you for your partnership. I also need you to know a few people on my staff who tend to work quietly behind the scenes, but I want you to know who they are, and I want you to know their names. I say all the time, we want to keep politicians and lawyers out of the exam room, right? We want that conversation to be between a doctor, a nurse, and a child or a parent. But sometimes we do need lawyers involved in these conversations, particularly when you have a tax coming on healthcare. And I've got two extraordinary lawyers who lead this effort for me. Mike Fisher and Jacob Boyer, who join us here today, have been leading our work to protect healthcare here in the Commonwealth of Pennsylvania. You're going to hear more about their work in a moment. They're joined by my Deputy Chief of Staff, Lindsay Malden, who leads our healthcare work. Lindsay, thank you for all of your incredible work. I'm of course here today as your governor, but I want you to know I'm also here today as a father of four, and I think about these healthcare issues, particularly when it comes to children and families, through that prism. What would I want as a father for my children? And then how do I make sure I deliver that for all children across Pennsylvania, the nearly 2 million children in our Commonwealth? Lori and I want for them the absolute best medical care with accurate information, the best medicines and treatments and vaccines that they can have so they can live healthy lives. And as parents, we want the freedom to make decisions for our children in their best interests in consultation with medical experts. We don't want politicians who don't know best taking away our freedom to be able to be parents over our children and interrupt or interfere with the relationship with our doctors. I believe the same thing is true about vaccines. I want the freedom to be able to provide my children and to be able to take myself the vaccines that I think are necessary to keep me and my family safe. I think we need to have clear and accurate information and fact-based recommendations coming from doctors in Pennsylvania. And I believe all Pennsylvanians should have access to the vaccines that they want for themselves and their children, and then the freedom to be able to make decisions that are best for you, especially here in Pennsylvania, especially here in Philadelphia, just a few blocks from where this grand experiment in freedom began. This is the birthplace of freedom, and I think medical and healthcare freedom is central to those tenets of what we need more of in this country. I want trained professionals who know science to be empowered to guide you. I do not want you to be guided by someone like RFK Jr., who I believe is wholly unqualified to give medical advice and who is restricting our freedoms here in Pennsylvania and across this country. We have seen, sadly, in recent months, the President of the United States and RFK Jr. spreading blatantly false information about vaccines and their efficacy. And they're taking real concrete steps to restrict your ability to get access to a vaccine or your ability to decide what vaccines your child should get. Let me give you just one example. RFK kicked off 17 highly qualified medical experts off of the Advisory Committee on Immunization Practices, known as ACIP. Now, everybody in this room knew what ACIP was. I don't think a whole lot of people knew what ACIP was before RFK Jr. blew it up, including the very competent, the very qualified Charlotte Moser, the co-director of the Vaccine Education Center right here at CHOP. He then replaced those you can clap for Charlotte, that's okay. And then he replaced qualified people like Charlotte with a whole bunch of vaccine skeptics who willfully ignore science and embrace conspiracy theories. That's dangerous for healthcare. And remember, this is the group that recommends which vaccines should be used for which patients. And until recently, Pennsylvania relied on ACIP to determine how we would recommend vaccinations. That created a conflict earlier this year because after the FDA approved the new COVID vaccine only for seniors and for those with pre-existing conditions, ACIP then didn't meet for nearly a month. Major pharmacies like Walgreens and CVS, as well as the small mom-and-pop pharmacies that we're fortunate to have in our communities, well, they were left without any clear guidance, and then they felt that they couldn't offer the COVID-19 vaccine to anyone, especially those who were explicitly included in FDA approval. In response, we didn't look to Washington for answers, particularly when you've got the conspiracy theorists running that place. Instead, I directed the Pennsylvania State Board of Pharmacy to meet and expand the list of organizations that pharmacists here in our Commonwealth could rely on for guidance as to who would be eligible for the COVID vaccine. Now, as a result of our action, pharmacists in Pennsylvania can look to medical experts who actually follow science. And that includes now, as a result of our action, the American Academy of Pediatrics, the American Association of Family Physicians, or the American College of Obstetricians and Gynecologists for their vaccine recommendations. As a result of that action, pharmacies here in Pennsylvania are now offering the COVID vaccine to people 65 and over and those with pre-existing conditions without a prescription, and anyone else can go in and get their COVID vaccine if they so choose with a prescription here in Pennsylvania. The Department of Health, led by Dr. Deb Bogan, who you'll hear from in a moment, issued clear, evidence-based vaccine guidance for other vaccines, recommending that doctors follow those same groups of medical experts I mentioned before, providing clarity in an area where Washington has tried to sow chaos. We are providing reliable, fact-based information, ensuring Pennsylvanians have full access to proven vaccines and the freedom to make the best decisions for themselves in consultation with their doctors. Listen, remember, I'm here not just as a governor, but a father. This is what I want for my family. And of course, I want that for every family in Pennsylvania as well. In just a few moments, I'm going to sign an executive order here at CHOP directing Pennsylvania state agencies to take additional steps to protect access to vaccines here in our Commonwealth and ensure that Pennsylvanians have reliable information available to them so they can make smart decisions. This executive order, which I'm about to sign, goes through 6 concrete steps. I'd like to walk through them briefly with you. First, I'll be directing Dr. Deb Bogan, who leads our Department of Health, to create a Pennsylvania-based program similar to the federal Vaccines for Children, which provides free vaccines for up to 1.5 million Pennsylvania children. So as I think you know, the access to vaccines through the federal program is based on ACIP's recommendations. And I know we're all worried about RFK's hand-picked folks on ACIP imposing further restrictions on vaccines that have long been proven safe and life-saving for our kids in the months to come. So we are preparing right now. And should that happen, we will have a Pennsylvania program in place in order to protect all God's children. Second, I'm directing all Commonwealth agencies to ensure our state regulations and guidance align with the recommendations of our nation's leading medical experts. We want Pennsylvanians to have reliable evidence-based information regardless of what happens at the federal level. Third, to that end, I'm also directing the Department of Health to create a central hub of vaccine information and resources, which is housed at pa.gov/vaccines, so folks have one clear place here in Pennsylvania to go to for actual facts, for actual science, and for answers. That website is now live, and it will be updated regularly as the Commonwealth takes additional steps. Fourth, I'm directing the Department of Human Services under someone I know you know well, who's a dear friend and doing an amazing job as a member of my cabinet, the head of the Department of Human Services, Secretary Val Arkush. Dr. Secretary Val Arkush is here. I've directed her together with our insurance commissioner, Mike Humphreys, who joins us here today. Thank you for being with us, Mike, to make sure that all FDA-approved vaccines remain covered by Medicaid and private insurance here in our Commonwealth. I want to thank Commissioner Humphreys, who has already been in touch with private insurers across the Commonwealth, and they have committed to Commissioner Humphreys and to my administration that these private insurers will continue to cover these vaccines at least through the end of 2026. I know that's been hard work, and we appreciate all your work with the private insurers. Fifth, I'm directing the Department of State, under the leadership of Secretary Al Schmidt, the Department of Education, and the Department of Aging, to clearly communicate our updated vaccine guidance to schools and senior centers and professional licensing boards to once again empower Pennsylvanians with actual facts, real science, and the information they need to make smart healthcare decisions. And sixth and finally, I'm directing the Department of Health to convene a new working group of pediatricians, family physicians, obstetricians, parents, pharmacists, public health experts, local leaders, and community representatives to develop a strategy for communicating publicly around vaccines, to clear up the misinformation and disinformation and provide real information to Pennsylvanians. At the same time, Dr. Bogan and her team will continue to work closely with our local health departments and our neighboring states through the Northeast Public Health Collaborative, which I've joined with other governors here in the northeastern part of the United States, to ensure that vaccine guidance is consistent across this Commonwealth and across our region. We'll be making it clear that here in Pennsylvania, we're following real facts, we're applying real science, and we're going to give Pennsylvanians the freedom to make their own informed healthcare decisions, and that we expect our insurance companies to follow suit. In the absence of clear and common sense guidance at the federal level, I want you to know my team and I are stepping up here in Pennsylvania. And listen, this isn't just good public health guidance. This is also really good for our economy. Let me explain. Because while our Commonwealth is proud to be home to world-class institutions like CHOP and top medical institutions like Penn and the University of Pittsburgh on the other side of the state, we're also one of the top sites in the entire country for vaccine production here in the Commonwealth, employing thousands of Pennsylvanians in manufacturing vaccines. In fact, more than half of all vaccines administered in the United States come from a facility here in the Commonwealth of Pennsylvania. This vaccine production is responsible for 4,700 jobs of our fellow Pennsylvanians and generates $4.74 billion for our economy. So look, I know you probably don't worry about that a whole lot when you're conducting important healthcare procedures, but it's also big business for us here in this Commonwealth. Our health, our safety, and our economy all depend on people having access to vaccines. And sadly, RFK Jr. and the President want to try and take that away from us. But hear me on this. They will not succeed. We will continue to protect healthcare access and your rights and freedoms here in the Commonwealth of Pennsylvania. So I want to thank CHOP for allowing us to be here today. You are the example of what it means to be an expert. You are the example of what it means to care for others. You are the example of what freedom is. The freedom to have access to an amazing place like this, to make your own healthcare decisions, and to have those healthcare decisions be made directly with a doctor, not with the interference of politicians or conspiracy theorists. You are the example I want to hold up, not just for this Commonwealth, but for this entire country. And I want you to know, as your governor, and as someone who could never become a pediatrician because of that organic chemistry class, I really value you. I respect you. I appreciate the work you all do, and I admire what you do. And I'm going to do everything in my power to continue to protect that unique relationship you and our pharmacists and others have with patients and Pennsylvanians. Thank you so very much for allowing me to be here today for this important announcement. In just a few moments, I'm going to sign this executive order. But in the meantime, I want you to hear from a few other wonderful advocates for healthcare here in Pennsylvania, including the leader of the Pennsylvania Department of Health, Dr. Deb Bogan.
Good afternoon. Thank you, Governor. It's really an honor to serve in your administration and to work on all things public health for Pennsylvania with you. So as the governor said, I'm Dr. Deb Bogan. I'm the Secretary of Health. And like the governor's father, and many of you here in this room, I am a very proud pediatrician. I applaud the Governor Shapiro for taking decisive action with this executive order to create a Pennsylvania Vaccine for Children program. It will help ensure that all children in Pennsylvania can get the vaccines they need to prevent diseases. It will also ensure that healthcare providers and families alike have the reliable, evidence-based information that they rely on to make informed decisions. The department is ready to take this on. Thank you. And we will work quickly to stand up this initiative so that it is in place before the next ACIP meeting. I want to tell you why this is so important to me. For a quarter of a century, it's a long time, I provided primary care for children and families in Western Pennsylvania. I saw firsthand the positive impact that vaccines had on them. When I began my career in pediatrics and in medicine, I rarely, if ever, saw diseases for which we already had vaccines, like measles, chickenpox, rubella, polio, diphtheria, and hepatitis B. Pediatricians practicing 30 years before me saw those diseases all the time. But thanks to the effective and safe vaccines, I have not. But during my career, I also saw the introduction of many other vaccines, including pneumococcal, Haemophilus influenza type B, and rotavirus, among others. All of these vaccines impacted medical practice, reduced hospitalizations, and serious infections. Today, pediatric healthcare providers training or providing care in the United States rarely see children with these diseases, thanks to effective vaccines on the childhood immunization schedule. Vaccines do more than prevent diseases. They prevent pain and suffering for children and the sleepless nights and worry that comes with caring for a sick child. For those more focused on the bottom line, vaccines also reduce missed days at work and at school. Unfortunately, more and more we are hearing conflicting narratives surrounding the safety of vaccines, and so are parents. As a result, a small but increasing number of parents decided to delay or forego giving their children vaccines. Over the past 5 years, we've seen about a 3% decline in the measles, mumps, and rubella vaccination rate for children entering kindergarten in Pennsylvania. And we've seen similar rates of decline in other vaccines. We cannot afford to go back to the days when diseases such as diphtheria, measles, and polio were common. A clear, concise, evidence-based vaccine schedule for children has saved countless lives, both here in Pennsylvania, across the country, and across the world. So to ensure the continued use of evidence-based vaccine schedules, a little over a week ago, as the governor said, we published vaccine guidance that is supported by the state's boards of medicine, nursing, and osteopathic medicine. The guidance is based on the recommendations from 3 professional medical societies the governor just talked about, which have been providing reliable, evidence-backed vaccine advice for decades, even before ACIP was formed. As a pediatrician, as a mother, and as a Secretary of Health, I am very, very supportive of the governor's executive order that will further protect vaccine access and the health of Pennsylvanians. So thank you, Governor, and thank you to the Children's Hospital of Philadelphia and all pediatric healthcare providers across the state. In these tumultuous times filled with misinformation regarding vaccines, I encourage people to turn to trusted healthcare providers like all of you here in this room. So now I'd like to invite former ACIP member Charlotte Moser to the podium. Thanks so much.
Hello, I'm Charlotte Moser. I'm the co-director of the Vaccine Education Center here at CHOP, and until recently, as was stated, a member of the ACIP at the Centers for Disease Control and Prevention. Changes in the federal government's approach to vaccines are creating unnecessary risk, and they are devastating to those of us who've dedicated our lives to protecting children from infectious diseases. Thankfully, Pennsylvanians have a rich history of using the tools available to protect us against infectious diseases. In 1778 at Valley Forge, right down the road from where we stand today, Washington ordered that his troops be protected against smallpox. And Pennsylvania was the birthplace for vaccines against polio, measles, mumps, rubella, and rotavirus, among others, transforming the health of not only our youth, but of people around the world. So it's only fitting that we stand here with Pennsylvania's Governor Shapiro to make sure that on a path to a healthier future, the people of the Commonwealth move forward and not backward. The potential benefits from vaccines have only grown over time, and CHOP and the Commonwealth have continued to lead the way. At CHOP, we've developed some vaccines like those for rubella and rotavirus, and we've conducted clinical trials for many others, including chickenpox and COVID-19. But education is also essential to our mission. For the last 25 years, the Vaccine Education Center has helped people get clear scientific answers to their questions about vaccines and the diseases that prevent them. The last part is especially important when so many of us don't remember the extraordinary costs associated with infectious diseases, or even how easily they can spread. Measles, for instance, is so infectious that you can get it without even coming into contact with the person who's infected. making Dr. Bogan's work to track infectious diseases such an important part of our efforts to keep kids safe. The pathogens that cause infectious diseases are an enemy that doesn't care about our politics, our beliefs, our fears, or even state lines. So thank you, Governor Shapiro, for your leadership in this moment. We stand at the ready to help fortify the Commonwealth's access to vaccines that protect our children, our families, and our communities. Thank you.
Good job.
I'd like to turn things over to Diana Montoya Williams. Diana is an attending physician here at the Children's Hospital in the Neonatal Intensive Care Unit. She's a research scientist with our Policy Lab team, and she's a mom.
Thank you. I stand here first and foremost, as you heard, as the mother of two vibrant little boys. Their joy, their safety, and their ability to grow up healthy and thriving is what matters most to me. I remember as a new mom counting down the days until they could get their first set of 2-month childhood vaccines and the relief I felt knowing I had started to protect them. These days, to help my children overcome the fear of the poke and also to reinforce for them that we are doing these vaccinations both for themselves but also to protect our community, we've turned our annual vaccinations as a family affair. My husband, my 2 sons, and I all put on superhero capes and we head out together to a local pharmacy to get our vaccines at the same time. You can ask my husband. Doing this, though, is also the way that I can sleep at night, knowing that I'm doing everything I can to access the safest, most evidence-based tools that modern medicine has to offer my children so they can grow up happy and healthy. As a neonatologist, or baby doctor, which is what my kids call me, I have also stood in my ICU and had to put infants on breathing machines because they caught diseases that we could have prevented with a simple vaccine. Those moments never leave you. And I shiver when I think about the process of what it would feel like if I was a mom to 2 infants now, and if I was worried that my baby's access to life-saving vaccines was threatened. No parent should have to live with that fear. I'm profoundly grateful that here in Pennsylvania, we have made it clear that we will help families like mine keep our children safe. Vaccines are one of modern medicine's greatest miracles. They are hope for healthy futures. And as a mom, they are my love made visible in a vial. So thank you, Governor Shapiro, for helping us protect our children.
You're awesome. What costume do you wear?
We're all different
All
superheroes.
different ones? Thank you, Dr. Montoya Williams. At this point, I am going to invite those to join me in signing this executive order, and then I'll come back and take some questions from the media.
Hey, sorry, how are you? I just need a maroon coat behind you next to Megan. Hey, how are you?
Dr. Balaban, come join us, because I know you're wearing 2 hats here today with the PA Med Society as well. We're grateful. Everybody good? All right, here we go. Dr. B, that's for you.
Thank you.
Magna, great job on all this. Thank you very much. This to Magna because it actually has to get filed with the lawyers, so it happens. Magna, thank you for your great work on this. And Dr. Bogan and I will take a few questions from the media, and I'm just grateful to all of you for being here. Thank you very, very much.
Thank you.
Thank you. All right. We'll be happy, Dr. Bogan and I, to take a few questions from the media, if you have. Great. Seeing none? Okay. Go ahead. I thought I'd get out of here. Yeah. Go ahead.
Can you talk about which children will be able to get access to vaccines and vaccines for children analog?
Absolutely. I'm going to have Dr. Bogan speak to that.
Yeah, the Vaccine for Children program currently through the federal government covers children who are insured through the Medicaid program, are uninsured or underinsured. And so our program would mirror that because other children are covered through their health insurance.
And again, I just want to stress, if the federal government tries to undermine what has been an incredibly popular and useful and life-saving program, the Vaccine for Children program, we want to be ready to go with our state program. And so that's the work that begins literally now as a result of the executive order I just signed. Was there something else?
And when you said that all currently FDA-approved vaccines will remain covered in Pennsylvania, does that mean that the coverage remain exactly the same, or would there be any new limits?
Until the end of 2026, private insurers will continue to cover them as they have. Commissioner Humphreys has been leading that effort for us. And through our state Medicaid program, which is administered by Dr. Arkush, that will continue on for certainly as long as I'm around, which is going to be for a while. Anything else? Yeah. Go ahead.
Your idea of when this is going to be up and running, you said before the next ACIP meeting. For those of us who don't follow it as closely as you do, can you tell us when that is?
I mean, I just signed that executive order. It is all in effect right now. And I think you know the motto of our administration is GSD, get stuff done. We don't sit around and wait. Just go ask I-95 about that. We move quickly. And on this, many of the steps we've taken have already been implemented. Our team is working aggressively on it, and we'll be prepared to move immediately.
Yeah, so if the health secretary is restricting certain access to vaccines and whatnot, states are allowed to do their own thing. Like, can you just explain that, how that could happen?
Yeah, absolutely. Well, RFK Jr. doesn't run healthcare here in Pennsylvania. Dr. Bogan does as the health secretary. And I would like nothing more than to have a good working relationship with the federal government where they relied on facts and science. But in the absence of that, we're able to set our own rules and regulations and laws here in the Commonwealth. The 10th Amendment allows us, of the U.S. Constitution allows us to do that. So I'm exercising my authority as governor. These secretaries are utilizing the authority they have that comes from the people of Pennsylvania. And so we are not going to let those who do not believe in science, those who instead push conspiracy theories, dictate healthcare here in the Commonwealth of Pennsylvania. Anything else? Okay, yes.
Has the state felt any impact yet from the federal shutdown, and when the impact starts, where do you think it will be?
Pardon me. We expect to receive guidance from OMB, which is the federal budget agency, later today. And after that, I'll be able to give you a longer answer as to the direct effect we're going to have here in the Commonwealth of Pennsylvania. We have nearly 10,000 employees. We employ 80,000 Pennsylvanians. Nearly 10,000 of them are either fully or partially funded by the federal government. Should OMB, for example, should OMB's directive suggest that those people would not be paid by the federal government, either presently or with arrears, at the end of this, that would present a challenge for us that we'd have to meet in order to determine whether or not we could use state funds in order to cover their salaries. That is just one example of the kind of guidance we are looking for from the federal government. We expect to receive that sometime around 4 or 5 p.m. today. In addition to that, I want to make clear, Pennsylvania state government is open. We are fully operating. We are there to meet the needs of families who need access to human services for their children. You need to go to the DMV, it's open. You want to go enjoy one of our beautiful state parks that are free, they're open as well. So we're up and fully running while the federal government works through its challenges. Yeah.
Are there funding mechanisms behind some of these new working groups and things like that? And does the state expect to pick up the tab with state dollars for something like if we had to establish a state vaccine for children's program? Because right now we do get federal matching dollars for those vaccines.
We're prepared financially to be able to meet all the obligations I set forth in that executive order.
And just a quick follow-up question, I think for an insurance question. I know that we have a commitment from the private insurers to cover vaccines, right? But the state regulates the state regulated programs. Is there anything being done for plans under the ERISA?
I can ask Commissioner Humphreys to jump up and answer that if you'd like. Commissioner?
Thank you. We anticipate, as you mentioned, as the governor mentioned, that the plans that we approve plans on a calendar year basis. So we have approved plans for 2025 based on the guidance that was existing at the time of 1/1/25. So that is through this year, and we're approving plans for next year that'll keep that same guidance. So that's all the individual market, the small group market, and in addition, those private insurers have gone out and made statements that they plan to continue that coverage into the next year. And the private insurers are those that would administer plans under ERISA, for instance.
Thank you.
One or two more.
By the way, I hope you're noticing the difference between a press conference we have here in the Commonwealth of Pennsylvania with actual health experts answering your questions as compared to what you've been watching on TV coming out of D.C. Okay. Anything else?
Okay, this is going off the government shutdown. How will the shutdown and Pennsylvania's lack of state budget affect the people of the Commonwealth?
Pennsylvania is open for business. The federal government needs to work out its issues, and they're going to continue, obviously, negotiating that in D.C. Look, I mean, the entire federal government is controlled by the Republicans. They've got to figure out how to reopen the federal government and continue to provide services to the good people of this country.
Last one.
Thank you all very, very much. Okay?
Good work. Really good work.